Welcome to Have More Babies. I'm Stella. Today we're diving into something you've almost certainly seen, maybe with your own kids. That knee reflex, the little tap and kick.
Yeah, it seems so simple, doesn't it?
Totally. But it's actually profoundly important for understanding a child's health. We're going to unpack some medical insights drawing from places like Omega Pediatrics. Our goal today, to really get clear on why this test matters, maybe clear up some confusion. Sound good? Okay, let's unpack this.
Absolutely. And it's fascinating, Stella, because that simple kick, it tells us so much, way more than just, a muscle twitching. It's a real window into their developing nervous system, how it's all wired up and working.
That's a perfect way to put it, a window.
Mm.
So let's start right at the beginning. What is this knee reflex, technically
Yeah.
speaking? Omega Pediatrics describes it pretty clearly. Tap below the knee, lower leg extends. Simple. You picture the doctor, maybe with that little rubber hammer.
That's the one. And the key thing here is it's involuntary.
Right.
The child isn't deciding to kick. It's automatic, like hardwired into the system. It's a classic reflex arc, a direct neural pathway.
Okay.
Stimulus the tap goes almost straight to response the kick, bypasses conscious thought. And understanding that is crucial. It shows us how well those basic communication lines are working, even without the child having to, do anything consciously.
Wow. So it's like an instant system check. Very cool.
Yeah.
But why? Why is this specific reflex such a standard part of, well, pretty much every checkup?
Yeah, it's routine, but for really good reasons.
It's not just ticking a box, right? Pediatricians are looking for some quite specific things.
Exactly. There are three main reasons why it's so important.
Okay, let's break those down.
First up, it's a direct nervous system check.
Okay, how so?
That reflex pathway, the CAP signal going to the spinal cord and right back out to the muscle. It directly tests the health of that specific segment of the spinal cord and the nerves connected to it, the peripheral nerves. When the doctor taps that tendon, it stretches the big muscle on the front of the thigh, quadriceps. That stretch sends a signal up to the spinal cord, and almost instantly, the spinal cord sends a signal back down, telling that muscle to contract. Boom, the kick. If that pathway, that arc, is damaged or slow anywhere along the line, the reflex changes.
So it's like checking the wiring, making sure the circuit is complete and running smoothly.
Precisely. It confirms that the basic essential infrastructure is sound. It's fundamental.
Okay, that makes a lot of sense. Foundational wiring check. What else? Beyond just confirming the wires are connected.
Well, that leads straight into the second reason, assessing developmental milestones.
Ah, right, development.
Yeah. See, as kids grow, their nervous systems mature, and reflexes change along with that. Some reflexes babies have, they disappear. Others, like the knee jerk, they become more refined, more consistent. So, seeding a healthy, normal D reflex for a child's specific age tells the pediatrician that their motor and neurological development is, generally on track.
Yeah.
If it's absent when it should be there, or maybe looks different than expected for that age.
It could signal a delay.
Yeah.
Or something off schedule.
Exactly. It's a clue. It prompts the question. Is the child's neurological system developing as expected? It's about timing and maturation.
Got it. So it's not just if they kick, but how they kick relative to their age.
You got it. It paints a picture over time.
Okay, nervous system check, developmental milestones. What's the third angle? Does it flag potential problems?
Yes, absolutely. And that's the third key reason. Identifying issues.
Like an early warning system?
Sort of, yeah. An abnormal reflex, either too strong, too weak, or absent, can be one of the first signs of an underlying issue. Maybe something with the nerves themselves, like a neuropathy, where the nerves aren't sending signals correctly.
Okay.
Or it could be an issue with the muscle itself, a myopathy, where the muscle isn't responding properly even if the signal gets there. So this quick test can kind of help narrow things down. Is the problem likely in the nerve pathway, or the muscle, or maybe higher up in the central nervous system? It's often not a diagnosis on its own, but it's a really valuable first clue. It tells the doctor, hey, maybe we need to look a bit closer here.
Wow. That little tap carries a lot of weight then.
It really does. Simple action, complex information.
All right, so for parents listening, maybe they've watched this happen dozens of times. Can you walk us through the actual procedure, step by step? What's the doctor doing?
Sure. It's usually very quick and straightforward.
Okay, so first step is positioning, right?
Yeah.
Getting the child set up.
Exactly. Usually the child sits on the exam table, legs dangling freely, or sometimes they might lie down with knees bent. The main thing is the leg needs to be totally relaxed, loose,
Why relax?
Because if the muscles are tense, it can actually dampen or inhibit the reflex. You won't get a true reading.
Makes sense. Okay, so legs relaxed. Then comes the tap.
Then the tapping. The doctor uses that little reflex hammer, it's usually rubber, and they tap the patellar tendon. That's the firm band you can feel just below your kneecap.
Right there, okay.
Tapping that specific spot stretches the thigh muscle just enough to trigger the reflex arc we talked about. It's very targeted.
Gotcha. And then?
Then observation. That's the crucial part for the doctor.
What are they watching for? Just the kick?
Well, yes, the kick itself, the lower leg extending outwards, it should be pretty quick.
Uh-huh.
And then it should swing back to rest, usually painless, maybe a bit surprising for the kid. But the doctor's observing more than just if it kicks.
Oh, like what?
Like the quality of the kick, how fast is it, how strong? Does it swing multiple times? Is it the same on both legs? Symmetry is important too.
Okay. So speed, strength, duration, symmetry. Lots to see in that split second.
Exactly. All those details provide valuable information.
Okay. So after the tap and the observation comes the interpretation. What do the different responses actually mean? You mentioned normal, exaggerated, or no response.
Right. Those are the main categories the pediatrician is thinking about. First, the most common and what you hope to see, a normal response.
And that means?
That means everything is working as expected. Healthy nerves, healthy muscles. The signal went up, processed correctly in the spinal cord, signal came back down, muscle contracted appropriately. Check, check, check.
Good news. Signifies a well-functioning system.
Exactly. It's reassuring.
Yeah.
Confirms things are largely on track neurologically and muscularly for that part of the system.
Okay. But what if it's not normal? What does an exaggerated response look like?
An exaggerated response means the kick is, well, bigger than expected. Sharper, stronger. Maybe the leg kicks out multiple times from one tap, like a bouncing motion.
And what could that indicate?
It could suggest an issue higher up in the nervous system, like maybe in the brain or upper spinal cord. See, normally the brain sends down signals that kind of dampen reflexes,
Yeah.
keep them in check, smooth them out, like a brake pedal. If those inhibitory signals, those brakes, aren't working right, maybe due to an injury or condition, then the reflex pathway is sort of unchecked, and you get this over-the-top reaction.
Like the brake lines are cut, in a way?
That's a decent analogy, yeah.
Yeah.
It tells the doctor to potentially look more closely at the central nervous system's control mechanisms.
Wow. Okay. That's a clear sign to investigate further. And the third outcome, no response. Nothing happens. That sounds worrying.
It definitely warrants attention, yes. If there's absolutely no kick, no response, it's a red flag. It means there's a break somewhere in that reflex arc. The signal isn't completing its journey.
Where could the break be?
It could be anywhere along the path. Maybe the sensory nerve didn't pick up the tap signal properly. Maybe there's damage to the nerve conducting the signal up or down, like a pinch nerve maybe. Or it could be an issue within the spinal cord segment itself. Or the problem might be with the muscle, it's getting the signal, but it just can't respond.
So lots of possibilities.
Yes. But the absence tells the pediatrician clearly. Something is interrupting this fundamental pathway. It doesn't automatically mean disaster, but it absolutely means more investigation is needed to find out why it's absent.
Right. It's an indicator, not the final word.
Exactly. A very important indicator that guides the next diagnostic steps.
That's really helpful to understand. It puts that simple test into perspective. So for parents listening, maybe you've watched this test, maybe you're curious, maybe even a bit anxious about it. Hopefully this gives you a new appreciation for what's going on.
Yeah, knowledge is power, right? Understanding why these things are done can ease anxiety.
Definitely. And if this conversation has sparked any questions for you, maybe concerns about your own child's development or their reflexes?
Well, that's where professional guidance comes in. This information is great, but applying it needs expertise. If you do have concerns or just want to learn more tailored to your child, we really recommend checking out the resources from our source, Omega Pediatrics. They offer truly expert advice and comprehensive care. You can visit omegapediatrics.com. Seriously, check it out. They have loads more information on child health topics, including development, and you can find details on how to connect with them. Even book an appointment if you need specific advice. No strings attached, just good info and access to care.
That's omegapediatrics.com, a really valuable resource for parents.
Definitely worth bookmarking.
So we've covered a lot today, from the simple tap to checking nerve pathways, tracking development, even catching potential issues early. It's pretty amazing, isn't it? How much one little involuntary kick can tell us.
It truly is a small window into a complex system.
Makes you wonder what other subtle signals our bodies are sending that we just, don't notice or understand yet.
Always more to learn.
Thank you so much for joining us for this deep dive on Have More Babies. If you found this useful, and we hope you did, please do us a favor. Go ahead and like this video, it really helps, and subscribe to our channel so you don't miss future deep dives. Oh, and share this video. Share it with other parents, friends, anyone who might find this interesting or helpful.
Yeah, sharing knowledge helps everyone. And always remember, understanding is the first step. Stay curious, keep asking questions, and don't hesitate to reach out to healthcare professionals like those at Omega Pediatrics if you have specific concerns. Thanks for spending this time with us today.
That's all for this one. We'll be back soon with more insights to help you navigate parenting and have more babies. Goodbye for now.